Patient's a 56-year-old female who was admitted to the emergency room a week ago for a compression fracture. She had fainting spells and she fell down and injured herself. Upon x-rays, she discovered that she has a fracture of her left hip, fracture rather. Likely due, the fainting spells likely due to acute hypoxemic respiratory failure. So she probably her oxygen saturation. They suspect her oxygen saturation fell so low she became faint. She fell down and she injured herself. She has a medical history of COPD, Raynaud's disease, fibromyalgia, arthritis, scleroderma, anxiety, pulmonary hypertension, depression, GERD, hypothyroidism, pneumonia, and an appendectomy. She had her appendix removed. Her allergies are penicillin, shellfish, hydromorphone, trazodone, and adhesive. Some adhesive bandages bother her skin, and that's it. And iodine. Her husband's in the room often. He's helping her out with care. He's very attentive, so he's watching your urine output, things like that nature, asking a lot of questions, which is good. She has two daughters and a son, and she worked in human resources. Right now, she has a lot of pain in her lower extremities. Her legs, her feet are very, very tender, even tender to the slight touch. So you've got to be very, very careful when you go in there. And if you assess her legs, she prefers that you let her know when you're going to do it, obviously, so she's aware, so she can, kind of brace herself for some of the pain. So just limited touch down there, if you could, for her legs. Again, the fracture is her upper left hip. Right now, one of her daughters is a nurse, and she's requesting for no one to flush her CVC, internal jugular central line, which is the right side central line. She's not in isolation, no restraint. She is a very high fall risk, so be very careful. But she can't move much because her legs are hurting her so bad. Got to make sure we turn her at least every 2 hours, and her husband's very proactive with that. He's helping her turn her slightly so she does not develop any pressure sores. Drains, peripheral IV, left hand. She's a very, very hard stick. We were in there. We had a Doppler in there, and even they had a hard time finding a peripheral vein for the left side. She's got a Foley catheter, a rectal tube. Let's see here. Again, she's got pain up to 10 upon palpation. Even light palpation, she's got high pain. Oxygen's 2-liter nasal cannula, bed rest. She had a cardiac diet. Her last input and output is 2100 in and 3200 out. She's got no scheduled labs this time. As a matter of fact, they're looking to discharge her to not discharge her, but to transfer her to a lower floor, a lower level of care. They're concerned about an infection that settled in. Her white blood cell count is 5,900. So you want to keep an eye on her blood pressure. Now her baseline blood pressure is 95 systolic over 65. That's where she lives. But we went in there a few times. Her last blood pressure readings were quite low. So we're a little bit concerned with that, and the doctor is aware of that. So continue to monitor her blood pressure. Her oxygen saturation was about 91, 92%. But again, she has COPD, and she has, the respiratory failure. Her creatinine is a little high, 1.35. Her potassium, that's where we needed to start a new line for her potassium, because potassium is 3.4. Obviously, potassium is in a completely different line than any other line. So as soon as the nurses, or as soon as the staff, as soon as they're able to find a vein with the Doppler radar and get a new line in, we can administer potassium. Until then, we're going to give her supplements. Again, her potassium is a 3.4. It's a little on the low side. Everything else looks good. She's awake. She's alert. Let's see here. Again, let's go over a few nursing interventions, and then we'll wrap it up. Again, watch her airway. She's got some secretions because of coughing. Her hypertension is a little bit on the high side. Pain. So we want to get her oxygen up to 95%, and try and get her blood pressure up. And that might have to go through different medications for that, per the doctor's orders. So I think that's it. Let's wrap it up. Any questions? Good.